Okay, awesome. So, welcome back, ladies. Welcome back, Lakyn and Brooke. Unfortunately, Corey couldn't be here to join us. She was a little under the weather, but she is missing it for sure. I'm sure she'll put her input on what we talk about here today. And what we're going to start with today is pregnancy. Now, obviously, you could tell by myself that I'm not going to know a whole lot about pregnancy and what you gals go through. So most of the conversation is going to be on your end. I'm going to ask a question here or there, but I'm just going to kind of let you guys go or let you guys go back and forth and just discuss amongst yourselves. Sound good?
Yeah.
Awesome.
Mhm.
So I guess right off the bat, just for someone who really doesn't, obviously someone who doesn't know a whole lot about pregnancy, but what is different about someone who has CCI, EDS, Chiari? What is different for them when they go through pregnancy as opposed to a quote unquote normal person? And either one of you can answer to start.
Yeah, that's a really good question, and one I wish I would have known the answer to before I got pregnant. So I knew I had all of these problems. Well, not like Chiari and CCI, but I knew I had EDS and dysautonomia and all those things when I got pregnant, and I was pregnant in DC, so a fantastic medical area. And I really trusted my doctors, and I told them I had these issues, and they're like, no problem, it won't impact you at all. And that is really not the case. I've been informed since that like the way I delivered was wildly inappropriate for these problems. So it's just really hard. Like I knew I had these problems. I informed my doctors. I was seeing the top medical specialists, and it was still just like so bad for my health, my pregnancy and delivery process, and it didn't have to be. So I love that. Yeah, even though this isn't, your cup of tea, your topic, it's really important that people in our community get this information, because it's unfortunate, but your doctors might not always know the best. And hearing from people who have gone through this gives you a little bit of power to stand up for yourself and advocate for yourself and make sure these won't be issues for you as well.
Okay.
Um, I did not know I had these problems, and I am a mother of four, but I've had 7 pregnancies. So one thing I did know I had was factor V Leiden. It is a blood clotting disorder that is very common with Chiari and other of these conditions, but not one that is typically like mentioned. So my body overclots. And so I'm on blood thinners through the pregnancy. And that the factor V is known for high miscarriages and high aging of placenta too quickly. Some complications I had due to EDS that we did not know at the time was preterm labor. I went into labor between 18 and 20 weeks every pregnancy, and I was on bed rest my entire pregnancies. I was deathly ill. So some things like not mentioned were, you are more sensitive to your hormones. You are going to be like just basic, not even that bad ones. Like you're going to be more fatigued. You're going to be in more pain. You're going to be more susceptible to the miscarriages, the high risk pregnancy. You need to watch your heart and your dizziness and the headaches. You need to have a closer eye on your blood pressure, and chance of preterm labor, that is the irritable uterus. Then your body loosens up during the 3rd trimester to prepare to give birth, and there's a great chance you're not going to come back together from that. And the more pregnancies you have, the looser your body is going to get, and increase risk of muscle separations, dislocations, and then that the way you deliver does matter. We are extremely blessed that I am not paralyzed from having 4 births the way I did. I don't know that people really per se, okay, I'm not going to say I'm a medical person and this is why it is. I'm going to say this is my understanding of it, is because of the pressure it's putting on your spinal cord with the birth delivery, especially with like Curare, if your brain is falling into your spinal cord, and that people have become permanently paralyzed, especially if they have Curare and they've delivered.
Okay. Interesting. So I guess my follow-up to that, I know we touched on this a little bit in our first video, or our first roundtable. Why does it seem like that why is it that so many women don't find out they have CCI or EDS or whatever it may be until they get pregnant or until they go through those pregnancy stages? Why do you think that is? Or if you have an answer, awesome. If not,
so one thing I've learned that most women's eat, like an average woman without any like virus or injury that has made her symptoms manifest earlier will manifest in her mid-20s. And that is typically often when women are having children, is in their 20s. And so I think there's a combination there, as well as anything stressful on the body can trigger it. I've had friends whose stuff was triggered by mono. That's someone's who's triggered with a severe flu, severe virus. And so I think part of it is pregnancy is a huge stress on the body and can trigger these conditions to manifest.
interesting.
Yeah, so like I mentioned, I knew I had EDS before my pregnancy, but all of my other diagnoses have came in the past year. So I only have one child, she's 3. Pregnancy, like Brooke mentioned, a lot of pain, fatigue, but we're used to that stuff. The nausea was extreme, like Brooke mentioned, you can be more allergic to pregnancy hormones. I threw up every day, several times a day, literally until the day I gave birth. But for me, pregnancy was better POTS wise, because during pregnancy you retain water, so that was really good for my dizziness, and my POTS felt really great. But then my birth, my daughter was breech, so I had to have an emergency C-section, which came with an epidural, and the epidural is the kind of the catalyst that sent me spiraling and my health declining over the past year. I didn't know that was something that I shouldn't have, but with EDS, your connective tissues are everywhere. They're in your spinal column, and it makes you way more susceptible to having a spinal fluid leak. So the epidural, we know, led to a spinal fluid leak. The anesthesiologist came into my room afterwards, made it sound like absolutely no big deal. This happens a lot. It'll go away. It's no problem. It didn't go away. They gaslit me and made it sound horrible to do anything about it. I just needed to go home, drink caffeine, it would go away. So 2 years later, I'm still feeling terrible. I, by this time, had gaslit myself into thinking that this was postpartum depression that just lasted for 2+ years. I thought it was all in my head. I just got to this really, really bad place with physical and mental health. And that was why I didn't want any more kids, because I was like, if this is what postpartum is, I don't want to do that again. So it turned out that it was all because of this spinal fluid leak, which caused just massive problems with my body. But from that, it's when we found the Curare and the CCI because of imaging for the spinal fluid leak. And these things really are just all connected. If you find one and you keep plucking at things, you're likely to find some more. So I think definitely what Brooke said, the timing and things being a trigger, and then if something is triggered and you're digging deep, it's likely that you're going to find some other stuff hidden down there.
Interesting. Very interesting. So one thing that I've learned over the last few weeks and months as I've researched more about this is that cell flares tend to be a big thing. And I know they pop up not just during pregnancy, but during other times. So my first question is, what exactly are cell flares or mental flares, however you want to classify it? And then what is the best way that you two feel to cope with those?
Like mast cell flares. I wish Corey was here for this, because that's something she's dealing with right now. And I have not been formally diagnosed as having mast cell. It's, kind of on my priority list somewhere behind my skull falling off my spine. But I'm allergic to absolutely everything. I know if I looked for it, I would be diagnosed. And I think it's hard. Like everyone says, find your triggers. But today, randomly walking up my stairs, the inside of my mouth and down my throat broke out in an allergic reaction. Like I was walking up my stairs. What am I allergic to? The wall. So it's like very, very challenging to actually find and realize all of your triggers. And because I haven't been formally diagnosed, that is not an area that I am good at all. So I will totally turn this one over to Brooke.
Yeah, so I do have mast cell activation syndrome, also referred to MCAS at times, or mast cell. It is where your body believes you are allergic to a lot of things. Your body overproduces histamines. I am allergic to many things, but if you were like to do a blood draw or an allergy test, not all those things will show up, because it's more like my body thinks I'm allergic. And so it depends on the flare, how it manifests for me and how I cope. And sometimes you don't know the trigger. And sometimes you do. It can be, if I'm in a flare, so there's foods I can't eat ever. And then if I'm in a flare, there are foods I can't eat while I'm in a flare, but I can eat when I'm not in a flare. And like I'm allergic to hormones, which complicates life as a female. I am allergic to the pregnancy hormone. I ended up on PICC lines, barfing 30 times a day, all the way through delivery, like Lakyn said. Had home nurses, lived for my IVs. Nowadays, like a typical mast cell flare, I will scratch myself sometimes till I bleed. It's so bad. It's uncontrollable. Otherwise, I will scratch myself and I will have black bruises where I was scratching. Even if I wasn't scratching that hard, welcome to EDS, you bruise easy. I will have migraines, joint pain, foggy head, hives, like you can have the itchy mouth and throat, like just any typical allergic reaction you could think of, but then you have others on top of that. As far as coping, I think this is really hard to speak to, but very important to speak to, because it's so much a mental battle. If you just let the situation control you, you are just going to spiral into depression, because it will feel never ending. I think for me, the huge aspect of perspective I try to keep is this is today. It doesn't mean it's going to be tomorrow. And if it is, I think, okay, but I'm not going to think a lifetime of mast cell. I'm not going to think a lifetime of EDS because that is depressing. So I'm going to think about today and what I need to do to get through today. Sometimes I take like full dosage of Benadryl and hide under a pillow. Other times I take a shower, drink Powerade. I don't know. I think it varies so much, but I think it's so important. And speaking to the mental aspect can speak to really any of the conditions that we face, because so much is a mental game.
So Brooke, I really like your description, because like when you first hear something like a mental flare or a cellular flare, like I'm sure that I could try and tell it to somebody and they'd be, oh, it's just like a really bad headache. And that couldn't be further from the truth. So I really like that explanation that you gave. So yeah, so I think we're gonna try and make this roundtable a little shorter. I mean, obviously Corey isn't here, so I really just have like kind of one last question for you two, and answer it in any way that you feel. So let's say that you meet someone, again, whether it be EDS, CCI, any of the stuff they may have, and you learn that they're pregnant. What is the one thing or one or two things that you're going to tell that person to help them with that process?
Yeah, that's a really, really great question. I just had somebody message me on Instagram who had found out they are probably going down the CCI path. And her daughter is as well. And her daughter is currently like in her third trimester pregnant. And so I struggle with, I never want to be that person who's like, I'm like telling them all the stuff they already know and like coming off as bossy or holier than thou. So it's like a place of struggle for me. But I can't imagine what I would have given to know these things going into pregnancy and to have been empowered by these things. So I was just like, hey, like, here's my story. Here's what happened to me. Like, do what you want with this. And so she was able to take that to her daughter and to her daughter's doctor, and they've advised that she'll be birthing with a C-section under general anesthesia to avoid any of the stress of pushing and the problems with an epidural, which is really the way I've been now advised that I should have given birth. So that's great. And they already have her scheduled for diagnostic imaging post-birth to kind of see what her Chiari situation looks like after. So I just think that's really great that not only are these people with these problems getting educated, but they're able to educate their doctors, who hopefully the next people who come in, they'll do things the right way and do right by them. So yeah, I think just telling your story is really all you can do, and hoping that somebody can use it to make their life a little bit less crappy. And I feel like that's the reason why I wanted to start posting more about my health. I'm used to keeping my health extremely private. I mean, I don't even tell like my best friend what's going on. So putting everything out there on Instagram and YouTube is still very new and scary to me. But the people, I think Brooke and I have both talked about this before, like when we found out that we might have had CCI, we found people on YouTube who had posted about their whole process getting diagnosed, wearing their collars, and that was life-changing for me because I was able to be empowered by that knowledge and by their experiences. And I was really hoping that my birth story and my chronic illness story could maybe make one other person's life a little bit easier.
Awesome.
Oh, I think it's hard not to like water hose them. I like to start with saying, do you have a specific question for me? What knowledge do you already have? And then, are you open to me sharing what I've learned or resources for you? I think it's really important to understand just the increased risk pregnancy has on the body, and with increased stress, what to keep an eye on for postpartum as well. to have the game plan laid out with your doctor about the safest way for you to give birth. It might look different person to person, because there is also risk going in with a C-section and surgery and healing with EDS, but that may be the safest choice for your body. I don't think there's any best option for us across the board. I think, I think just like maybe part of it is plugging them in to a community to help them afterwards, and the journey that possibly could be triggering, as well as becoming a mother with chronic health problems that can feel isolating, and it takes some tough kiddos to deal with it too.
I'd imagine so. So actually, while you're talking, I actually just did come up with one more quick question for you guys. Again, I'm sure a lot of other future mothers might be curious about this. What are the chances of your children getting the same illnesses that you guys have? Is it high? Is it low? Is it like 50-50? What have you heard within your communities?
Oh, Lakyn, you are muted if you want to talk.
Awkward. Sorry, go ahead.
I don't know that they can say per se yet the exact percentage of passing it on. I'm going to say thus far in my household, it's been 50-50. I have 2 children confirmed. And then he is too young to really diagnostically know. He's 4. They still hold a lot of flexibility at that point and other symptoms. And then, so as of right now, my oldest and my 3rd son both have it, or we know they have it. We have not gone and officially, sweetie, not gone and officially gone to the doctor that will officially put it on their medical records, but our family doctor and doctors across the board agree. They've started physical therapy for it. It's not as common for males to have it, though I do know males with it. And I think that will be interesting. So, I mean, you can probably say it's 50-50, but do they know? I don't know, because I'm the only one out of five kids on my side of the family that has it.
Okay.
Yeah, that was really important to me, and that's the reason I ended up getting diagnosed. Like, we've known for years I probably have EDS, but it didn't really matter to me to have a diagnosis because, you know, there's nothing they can do for it if I'm living my life as if I have it. But when we were looking at having a child, it really mattered to me if I could pass this down. So I went to the genetic clinic at Hopkins, which is excellent if anybody needs to have any of this kind of stuff done, because I don't understand genetics, and I know there are many different kinds of EDS, and you know, if it was possible for me to pass on one of the extremely dangerous kinds, like maybe we would have looked at not having children. So they told me there, like Brooke said, 50-50 chance that she could have it or future children could have it. My daughter's 2. It's way too young to tell, but I think being armed with this information is valuable. Like I think Brooke said something similar, but like I was a competitive cheerleader and gymnast, which is the dumbest thing you could have done with EDS. So obviously my daughter probably will not be doing that. So it's kind of a catch-22. I also don't want her to live in a bubble. So yeah, it's a weird place to be in, but yeah, it's kind of a decision you have to make for yourself.
Okay. All right, awesome. Well, ladies, thank you again. If there's anything else you feel like you want to add to the conversation here, that's all that I have for you. It's all that I've come up with. We good? How we feeling?
Great. Thank you so much.
Awesome.
Yeah.
All right. So thank you again, ladies. Appreciate this. Hopefully we'll be back for part 4. Haven't decided yet what we're doing for that, but subscribe and follow, and happy trails. All right, let me stop the video, or let me stop recording.